Okay. Oh, Emily, go ahead.
I will
I'm
get
sorry.
started. No, that's okay. Good afternoon, everybody. Thank you so much for joining us on this lovely Wednesday afternoon for our Win for Supportive Housing monthly webinar. My name is Emily Vans. I am joined by my colleague oh my gosh, Dawn Reinhard Wood, who will be facilitating our webinar this afternoon. And we're going to focus on housing skills assessment and training for supportive housing participants. So before we get started, we do just want to send a welcome and a thank you out to Washington DBHR and the Washington Healthcare Authority. It is through them that we are able to provide these webinars to you every month. So thank you so much to them. I do also want to let everybody know that this is an interactive training, and we do encourage you to ask questions and interact with us throughout the session. Give us your feedback, give us your experiences, give us whatever information you want to provide in the chat. We are in webinar mode, so you cannot unmute yourselves. However, if there is something that you feel would be better shared through, verbally, please let me know, and I would be very, very happy to unmute you. But this is going to be interactive, and I think we always find that these webinars are so helpful because you do get to hear from other providers in the state and really get an idea of what's going on at other agencies. So please make sure to share your input. We're going to be asking you questions, but any information that you feel might be helpful to other providers, please let them know. Additionally, the slides as well as a link to the recording are going to be provided to everybody after the webinar. There is going to be a follow-up email that is sent out at some point. I also believe that webinars are being uploaded to the Washington State Healthcare Authority's YouTube channel. So this might also be accessible through the YouTube channel. Next slide. So everybody is automatically muted. If you do have the ability to be unmuted, like if I give you that permission, please just make sure that you try your best to keep yourself muted, as it can just kind of be distracting for us as the facilitators. I don't think anybody's video is able to be on in webinar mode.
Yeah, I think this was left over from meeting mode back
That's
in
okay.
the day. Yeah.
That's okay. Yeah. So the video you shouldn't have to worry about. I don't even think we can turn anybody's video on in webinar mode. So we don't have to worry about that. Again, if you have any questions, please feel free to put it in the chat box. I did disable the Q&A just so that we have all the information in one place through the chat box, and everybody can chat with everybody else. Additionally, if you would like to be unmuted, I'd be very happy to do that. Just raise your hand or let us know in the chat box. And then we can have you talk about what you'd like to talk about. So just to kind of get us started on what we're going to be talking about today and what our learning objectives are, we're going to look at identifying the importance of housing preferences and skills assessment prior to tenancy, right? When we're providing housing services to individuals, we really want to make sure that we're working with the person to determine what their preferences are, and really doing an assessment of what their skills are so we know what we're going to be working on them once they are housed. We're also going to review a housing skills self-assessment for use in supportive housing tenancy and identify appropriate supports through group interaction. And then we're going to review some sample tools for moving on materials. So I will send it over to Dawn.
Thank you, Emily. Well, hi, everybody. I'm Dawn. So just to tell you a little bit before I get started, just to tell you a little bit more about me, I worked in supportive housing for about 16 years before I transferred over to Rutgers. As I like to say, I felt like I was getting a little too old for the job, meaning it was very difficult. I was a program director, so I was on call all the time. And so I do have an appreciation for how hard your work is. I was also a case manager and a homeless outreach case manager. So I understand you have extremely hard jobs. And so I just wanted to start there, and also ask you, because I know that we all have like a wealth of stories. I have about 16 years from a worth of stories from working in supportive housing, and I know that many of you will too. So I want you, like, as we're starting to talk about preferences for housing, keep, maybe one or two of your service recipients that maybe very, very well in mind when we're talking about what might be some of those things that those individuals may have, that you might imagine that they might have as preferences. You could also think about for yourself as well. So we're going to kind of get started, just orienting to actually preparation for tenancy. So when we think about a the idea of tenancy, what are some things that come to your mind in terms of skills that might be needed? And you could just type them in the chat or ask for the microphone. Yeah, so we're seeing budgeting, cleaning, being reliable, right? So being able to like abide by your lease terms, or know that when the trash is supposed to go out on Thursday, you need to take it out, these sorts of things. Yeah, time management, financial management. I love Sabrina's comment. Do they even want the housing right now? And for those of you who work, well, I'm sure that all of you are working with people who are either homeless or formerly homeless or unhoused, that people may be at different stages of readiness, even for something like housing that we would imagine if you've lived out on the streets, or if you've been moving from place to place for so long, you've been displaced. I think that sometimes we come into this world, this housing world and social service world, thinking that housing, those keys to the apartment, is what is so coveted and what people want and need, immediately to get going in their recovery. And folks aren't always ready, and there's a lot of reasons for that. And we could talk about that in a little bit, but yeah, and even Steven says how to even live in a home, right? Versus if you've been unhoused for so long, some of the safety measures that you go through, while being unhoused or living in places that aren't fit for human habitation, some of the ways you even sleep may be different. I remember early on in my career, something that had really shocked me was a circumstance with one of my clients in which he had been homeless for many years. He was referred to our PATH program, which was a homeless outreach program. We found him housing, and then he transferred to our supportive housing program for continued, case coordination, care coordination, that kind of thing, and subsidy management. He did not sleep in his bed. I'm sorry, that wasn't it. He slept fully clothed for almost the entire first month of his tenancy in the apartment, with most of his important documents still on his body. Because when he was unhoused, right, he needed to be ready to defend himself, to run, to leave, and have all of his belongings on him. And you may have stories, similar to that, maybe slightly different specifics, but so we need to start at a very basic level, that being, what are you ready for, and what are the things that are going to make you most comfortable in this new environment to kind of set the stage for recovery. So this is really good. A lot of great, yeah. And Carrie said, getting documentation, right? Knowing what organization, what social service agency, what federal benefits program you need to go to, and how to do it to get maybe documentation that you need, or things as simple as birth certificates, right? And so building housing skills is really difficult. And so we encourage organizations, programs, to start wherever they're at. So if it's street outreach, we should be starting to assess what the individual's housing needs and ask them what their preferences are from the start. Not only does it help us kind of formulate what is going to be the best fit for the individual, but also get their voice heard early on, and start that partnership and forming of a therapeutic rapport. But yeah, just being inside after being unhoused for so long, or being in places that you couldn't necessarily call your own, can be very triggering for some individuals. So from some of the research, what we do know is that by preparing individuals with the training that they're going to need, that being the knowledge and the skills for what it will take to sustain tenancy in the community, there is an indication that that contributes to a longer and more successful time period in the community before it is interrupted by things like rehospitalization, unfortunately, at times incarceration, and sometimes a return to homelessness. But the more education that an individual receives and the more skills training that an individual receives, the greater the likelihood is that they'll have longer tenure in the community. So some ways that we work with individuals to provide or to prepare them for tenancy are things like basic psychoeducation, right? I consult with our state-run psychiatric hospitals here in New Jersey. One of the things that we did, because they were really struggling to prepare individuals um, for tenancy, and they were seeing return rates, rehospitalization rates in the first 30 days creep up. And one of the things that people were saying was they didn't feel prepared enough. They didn't even understand, in many cases, what the characteristics or what the structure of the housing was going to be like that they were going to. And what I mean by that is, if they were going to a supportive housing program, or in Washington case, FCS program, what does that look like? Will staff be on site? Will they not be on site? How many hours a day will I have support? What kind of rights do I have? What are the rules? Things like this. And so people weren't quite educated on even where they were going. And many times never saw where they were going to be residing, right? In the community, it's a bit different, in which you could take people to visit properties if they're willing. You can have people see properties, but also at the end of the day, we also know that there's a limited stock of available affordable housing that will also meet requirements for rental subsidies and vouchers and all that. And so providing as much education as possible, including information on rental subsidies and vouchers and how that works, including what it means to be a good tenant and what a tenant can expect out of a landlord, the roles and responsibilities. Skills assessments, assessing what are the skills that the person has in relation to all of those things that you listed when it came to the skills needed to, maintain tenancy and a residency in the community. So things like financial management, understanding terms of a lease, basic safety protocol, when to call the police, and when is calling the police just going to get you in trouble because you're using the 911 line as a non-emergency line. I kind of giggle to myself when I say that, but it is so important because I've worked with individuals who did not her understanding was you call the police for help. I am out of cigarettes there at 2:00 in the morning, and therefore I am calling 911. And I had a tenant who did that repeatedly and was fined and had to appear in court because they were doing that. And so it was even that basic education of who to call, when, and for what, like what is appropriate. Skills training. So literally, when people maybe lack certain skills like washing laundry, learning how to cook, learning how to balance a budget. I was going to say balance a checkbook, but I don't know if anybody even out there does that anymore. If we have any checkbook users out there, please raise your hands. But helping people to learn new technology, right, that we need to be able to live, setting up automatic bill payments and things like that I'm still working on with my dad. But these sorts of things, there's a lot. And again, I'm saying this is a little bit more challenging when working with individuals who are in, let's say, like an acute setting, like a hospital or some sort of intermediate care setting where maybe you don't have the access to the community. But this is why we also encourage people to do this type of work outside of the hospitals where it's easier. And hopefully we'll get individuals in a situation where their needs and their preferences have been assessed and established well enough that they're going to remain in the community and never see the state hospital. And things like resource acquisition, right? So once you know what your budget's going to look like, are we going to be working part-time? Are we going to be trying to apply for additional, like heating and energy benefits, those sorts of things. So, also teaching people where to go when they have things like financial or other tangible needs. And so one of the things that Rutgers did was, because we saw this lack in our state hospital system of care, is that we developed a training curriculum. It runs as a group in our state hospitals. It originally started out as a closed group, meaning it follows a consistent flow of curriculum. It's chapter by chapter. We would admit people in, a group of people in who were deemed being ready for discharge in the next 6 to 9 months. And we would begin to prep them, by providing this education and training. The thing is that we now believe that this curriculum works well, inside hospitals, outside hospitals. It's a nice little kind of compendium of a few tools. It's not overwhelming. A few tools to just kind of assess an individual's preferences and needs and their support system. And it can really be used at any time during your relationship and any real level of care that you're working with the individual at. And in supportive housing, it's probably great to kind of reassess what an individual's preferences are. And when we're talking about housing preferences, those can change over time. What I feel like I need right now to make me happy in my housing, right now I'm in a little 1-bedroom apartment. 3 years ago, I was in a 3-bedroom home. My living situation changed, right? My relationship situation changed. I am now in a different location. I have certain preferences that I wanted with this apartment. Didn't have many. I wanted to be on a second floor for more safety. Plus, I didn't want anybody stomping around above me because I have a lot of sleep problems and I didn't want to worry about that. I wanted to be somewhere where there was a lot of trees, things like that, but I didn't have a lot of preferences. But think about the individual who maybe doesn't have transportation, perhaps can't climb stairs very well or has some mobility issues and might need to have the first floor apartment, or might prefer to be in an area that's more urbanized where a lot of things are within walking distance, right? Stores and these sorts of things. Think about like why you chose to live where you were. Were there any non-negotiable preferences that you had about where you were going to live? Apartment, single family home, whatever. Were there any non-negotiables? Yes, Emily, online banking. I glance at my balance every once in a while, and sometimes very hesitantly, I'll log in right before I start work. And I'll say, okay, we're still in the black. We're not in the red yet, so we're still good. Yeah, right. And so it went to just host and panelists, but like Ruth May said, a fence for the dogs. So like you don't want to, I know in some circumstances we can't take pets with us if we have to move abruptly or something like that, but dogs are important to you, right? They probably, if you're like me, my old kitty cat, she's 15 years old. She gives me a lot of anxiety sometimes because she's very needy and a little, she's getting up there in age and she's a little needy, a little medically needy. But at the same time, she gives me a lot of emotional support, right? So it was non-negotiable. I needed to find a landlord who would allow me to have a pet, Of course, I have to pay $50 a month for this little 8-pound ball of fluff, but yeah, access to longstanding doctors or other providers. So like, we don't want to place somebody somewhere where they're going to feel disconnected from their support network, whether formal or informal. Yeah, and like Shelley said, staying close to community, right? If they are an individual, especially who enjoys or maybe strives to be more integrated into the community, to maybe meet people, to maybe enjoy, things outside and recreational opportunities. Absolutely. Whereas there may be other people who prefer to be in a more remote area, right? And so I know that there's a lot of factors that also come into play and may limit an individual's preferences. Things like finances, right? I can't have that condo in Miami that I really, really, really want because, well, I would probably never buy something in Miami anyway because I think it's going to be underwater probably in 20 years. But at the same time, I need to be realistic, right? But there's, there's also other limiting factors such as, where landlords have available housing stock, what relationships you've negotiated with landlords. And again, getting back to what is able to be afforded, and finding those landlords, even though all landlords are supposed to be welcoming to rental subsidies and vouchers and treat them like legitimate income as they are in that sense, we know that there are struggles there as well, right? Great, thank you. So yeah, so you guys gave a lot of, a lot of your preferences definitely overlapped with our service recipients. And I'm not sure because you're working in the community, and I may be totally wrong about this assumption, so it's why I'm throwing it out there for you to correct me. Here in New Jersey, one of the phenomena that we see sometimes, at least in our state psychiatric hospitals, is individuals showing up in a hospital that is not within the county or near the region of the state that they reside in. So we have a Southern Regional Hospital in the southern part of the state where I live. It's about 25 miles from Atlantic City. And so you may have people, Atlantic City is a big tourism spot in New Jersey, right? So you have people go to Atlantic City, something happens, maybe they, their symptoms increase, and they end up in a state hospital in South Jersey when they may be from northern New Jersey, several hours away. And then they're going to probably be discharged to somewhere local near the state hospital. So we're already, we don't really want to do that as a standard of practice. We really want to try to connect the person with their environment of choice, right? Within the limitations that we have, and wherever possible, return them to their community of preference. Okay. So let's talk about some of the things that individuals need in terms of the skills that need to be assessed. So we say activities of daily living, right? So this activity of daily living, these are more hygiene related. Maybe we're getting into like the I call it like some of the medical skills, right? Illness, self-management, and things like that. But the basic self-care, self-hygiene skills that individuals need. Individuals that you're working with, if they are right, unhoused, or if they are coming from a psychiatric facility, a lot of individuals become, institutionalized to their surroundings, right? So the individual who may be unhoused, they may not have had access or financial resources to take care of their activities of daily living. Individuals in state psychiatric hospitals or individuals struggling or who have been diagnosed with a serious mental health condition, may have actually had some of those self-care or self-care needs unaddressed for a very long time. And in the hospital system or in hospital settings, individuals tend to rely on the institution for a lot of the care, right? So people may not even really be aware of things like when I need to set up doctor's appointments, things like, keeping on a dental schedule, right? Because in very many situations, people are used to things being done for or to them when they are a part of, mental health systems of care. Independent living skills, you all mentioned a lot of those. We were talking about the financial management skills, being able to even understand or read a lease. They can be complicated. So really boiling it down to those roles and responsibilities of the individual. Social skills. One curriculum that I would recommend to individuals working with folks with serious mental illness especially individuals who may have impaired social skills would be social skills for schizophrenia. It's a really good workbook and is a group curriculum that we use in the state psychiatric hospitals. So even working with people, especially around what may seem to us very basic communication strategies or communication needs, assessing whether individuals can, actually engage in those basic communication strategies is really important. I'm going to tell you why now. We did a little research around individuals who returned to the state hospital within the first 30 days and within the first year. And one of the most common reasons for returning to the hospital was, number one, they felt so alone because when they were in that kind of congregate environment, they had so many people around. The same could be said for individuals who may be in other transitional settings, right? Whether it be a shelter or something like that, they may have had to share space. And so that loneliness that they didn't anticipate creeping in does, right? So, helping work with people to develop their social network is important. The other thing that's really important is working with individuals to learn how to do things like make demands and say no to people, to deny requests. Individuals reported to us that one of the struggles that they had with their supportive housing workers, this was focused on individuals who went to our supportive housing programs specifically, was that they didn't know how to tell their neighbors or authority figures no, right? So you're a case manager or you're a housing specialist and you want to meet with this client on Tuesday at 2. And the client feels like I just kind of have to go along with it. And so when they may have something else to do at Tuesday or 2, or they may just not feel like seeing you on Tuesday at 2, but they lack that ability, that agency to be able to be spontaneous and advocate for their preferences and needs. As well, making requests of landlords, right? People had, in some cases, let damages in their apartment that were minor damages that got really, really big and caused major damages like water damage and things like this to nearby apartments because the individual did not know how to make a request to the landlord for maintenance, right? They didn't want to bother anybody. They were scared. Yeah, and Shelley, what you said about setting boundaries, I think it was, let me just see here. Yeah, setting boundaries. So that was that other part of being able to say no. One of the things that these individuals told us was that, they want to help people. They know what it's like being in need. These were the individuals who came back to the hospital, so they didn't want to turn anybody down when a person knocked on their door and asked for a cigarette, or when a person asked to borrow $5, right, to pay you back next week, and then they never got their money back. They didn't know how to turn down requests and say no, whether it was for money, tangible items, or even things like sexual activity. Things like that. And so people found themselves in difficult situations and sometimes altercations, excuse me, sometimes being at risk for losing their housing because they let other people stay. We know this is something that can happen, right? Friends that they may have had while they were unhoused or family members. So that ability to say no was really, really in deficit with this group of individuals. And so I say that to say, like, probably the individuals that you work with may have some of the same challenges. And so to think about, assessing that also, how do you make a request? How do you turn people down? I think it's a difficult skill for a lot of people, especially if you're a little anxious. Vocational skills. So we also want to assess, whether or not the individual has any desire to work. Where are they at with their readiness and their ability to work at this point in time? And that might sound a little overwhelming. Are we really going to start peppering them with all these questions and start talking about working when they're getting out of the hospital? We want you to. And the reason that we want you to is because, and we don't have one of our supported employment experts here today, but research does show that having um uh, gainful, I say gainful, having mainstream employment, meaning competitive employment, not a sheltered workshop, not a strict, vocational program, but actual paid competitive job increases the likelihood that an individual will remain in the community for a couple of reasons: greater financial security, and can anyone else guess what having a job may also do for people who are recently housed or maybe recently released from a psychiatric hospital or incarceration for that matter? Put it in the chat if you can. Yeah, self-worth, purpose, right? They have a reason to get up, a reason to get up in the morning. And so many of us, maybe we don't have the perfect jobs, but so many of us pick jobs that are some reflection of the values that we have. I'm going to guess that a lot of you like to help people. And that's probably a big part of why you're here, because you're not becoming celebrities and becoming really rich. None of us are, right? Doing what we've done or what we're doing. And so we have that value to care that's important to us, right? And that value to feel self-reliant. That's a huge value for human beings in general. Yeah, Sabrina, that inherent value, freedom to do things, social outlet. It's another reason why we encourage that. We meet a lot of people in the workplace. We don't want individuals who exit maybe a shelter or exit being unhoused, or enter housing from being unhoused, or exit a correctional system or a hospital system and just replicate the friends that they had on the unit, right? We want people to be able to spread their wings out and meet different people, meet folks at work, meet folks in recreational situations, meet folks at the grocery market, right? And that can be challenging. Here in New Jersey, I'll speak to the program that I ran. We had scattered site apartments in different apartment complexes. And then we had a couple buildings that had multiple apartments that were essentially our buildings. It was our tenants that were linked to our supportive housing program. And we really, really, really encouraged the tenants in those buildings to work, to do other things so that they had this broader social network, right? Good, Coley, and we're glad that you're here. And I think that that's the case for a lot of people, whether it's personal lived experience or familial. Thank you for sharing. Personal safety skills. So this can also overlap with teaching social skills. I think that it overlaps a lot, but it also, involves things like basic kitchen safety, basic medical first aid, right? Does a person have a first aid kit? Do they know what to do when they hurt themselves? What is really, really severe? What is, I should be calling 911? What is not a 911 call? The call for cigarettes, is not the 911 call. And I will say I'm a smoker, so I understand the urgency, but yeah, it just makes the police not like us very much. But assessing personal safety skills, right? And what that means to the individual. And as I said, that might overlap with social skills to a great extent, especially when we're talking about, aspects of human adult existence like sexual health and intimate relationships and friendships, relationships in general, teaching people appropriate boundaries, teaching people about things like consent, and just being I don't know, I kind of say street smarts, but you know what I mean, the stuff that a lot of us acquire throughout our lifetime, that perhaps some individuals need additional support around. um And me too, guys. I'll throw my me too in there too. It's good to be, oop, I'm sorry. Get back. Okay, and coping skills. So think about that group of people that I was telling you at the hospital that I consult with, who they found it intolerable being in an apartment, their own private apartment. They didn't have to share a bedroom with another individual. they had their own refrigerator. Their food was going to be there when they put it away. They didn't have to hide their snacks. Their documents were safe. They had, all these niceties of living in a residence, but it was unbearable because of loneliness, right? And loneliness then contributed for some people to relapse and or perhaps a disruption in their medication routine and things like that. A couple of individuals said, I wanted to come back to the hospital, and they literally went to the local psychiatric screening center and talked about what they were struggling with. And so, really looking at the individual's coping skills, and for individuals who may be early on in their psychiatric recovery, and perhaps sobriety as well, making sure that they have those warm line numbers, hotline numbers, and to know generally what their schedule is going to be in terms of somebody seeing them, right? So that they can anticipate it and, aren't, do not have this fear of abandonment that a lot of the individuals struggle with when they leave bigger institutions. You kind of feel like they're floating out there alone, even though they have you guys. It's not the same as having people there 24/7. Okay, just let me take a little sip here. So in the psych rehab world, one of the things that we talk about an awful lot is this idea of knowledge, skills, and abilities, right? So what is the knowledge that the person has about the housing situation that they're going to go into? Have they even been do they have any ability to select it? One of the things, with a lot of individuals is that their choices may be very limited. So giving individuals is not enough, as much information that they can have and as much choice as they can have where they can have it. Maybe you have 3 apartments that are available. And so it's that idea of like letting the person choose to the best of their abilities. Um, the skills that the individual needs, right? So this is where the skills assessment comes in, and we're going to show you, I think, a couple worksheets that we will send along at the conclusion of this webinar. You'll receive the Tools for Moving On curriculum. One thing that I will say is that there's New Jersey language all over it because, again, it was designed for the New Jersey State Hospitals. However, it was designed from a publicly funded SAMHSA toolkit. And so therefore we're free to distribute it and you're free to use it. Disregard the New Jersey language, but you can definitely use those skills assessments and the housing preference tool that is found within it as worksheets with folks. So we want to find out, like, what are those skills that they have? Part of this we can do by asking. Part of this we could do by looking at their history. And some of this is going to be trial and error. So, a lot of times we could have people tell me what you would do. Do you know how to do your laundry? Oh, yes, I do. What would the first step be? Maybe having them walk through some things that you think they may or may not have had the opportunity to experience before. So there was an individual, one of my colleagues was working with in a group home, or actually it was in a clubhouse. So you guys are probably familiar with clubhouse services, but for anybody who isn't or is new to the field, a clubhouse is like almost like a drop-in center or a place where individuals with lived experience can go, and they essentially can run the program. Like, everybody has a role in maintaining the program. There is some usual like organization that provides some oversight to it, but essentially the participants run the program. And there, my colleague was helping to teach somebody to cook, and she taught him to cook on an electric stove. Well, a few months later, he moved into an apartment. She's like, great, you know how to cook. It was a gas stove. And he set his shirt on fire because he wasn't used to working with a gas stove. Nobody was injured, lost the sleeve of the shirt. But again, this, right? So you knew how to do it in that one environment. Are you going to be able to replicate that in your new environment? So people may even believe, and they may have certain skill sets for the environment that they were in before, right? So not all the skills that they have, which may have served them really, really well when they were living in a group home, or when they were unhoused, or when they were in a transitional living situation, they may not necessarily serve them as well in the new situation. So always be thinking about the type of housing the individual is going to go to as much as you can, and what are the skills that they're going to need in that new living situation. And for some people, it's going to be the first time they've ever lived on their own as well. So we want to also look at the skills that they may have never acquired for individuals who develop serious mental health conditions. It's not uncommon for conditions to emerge in the late teens through the early to mid 20s for individuals. And so this is a time in our life when as budding adults, we're learning a lot about, skills that we need, independent living skills, activities of daily living skills, and how to kind of navigate that adult world, right? Working, the work world, how to apply for a job, all of these things. And for individuals who may have, experienced an onset of a severe mental illness between that age range, they may have missed out on some of the developmental milestones that the rest of us get the opportunity, or I say the rest of us because I include myself in that group, but that other people who may not have experienced that age of onset of a serious mental health condition, they may have acquired those skills. And so they may be figuring out things a little bit later. I know for me, it's going to be a little bit longer to figure out the relationship skills. And so, that was something for me that I had to work on. For other people, it may be, knowing how to cook for themselves, knowing how to tend to a home, those sorts of things. All right. So let's start by taking a look. I think the next couple of slides are samples from the workbook, or from the curriculum. So you can see what some of this looks like. So things like we go through, it's about 3 to 4 pages of this housing checklist. So it's pretty exhaustive. This comes from the SAMHSA Tools for Tenants toolkit that basically outline like the tools, or the skills, I should say, not the tools, the skills that individuals need to really be successful in the community, in their own housing. So things like you see here, general support needs. So there's several different categories. We have general support, we have independent living skills, program or mental health needs, substance abuse or addiction needs. And so you'll see throughout this checklist that it's broken down into several different categories. It's really long. So this is something when we do this, when we use this workbook in a group, I will tell individual or facilitators of the group to not think you're going to get through this in one single session with a person. So if you're meeting with someone individually, to start to talk to them about the skills that they need as you're helping them move into housing or identify housing for them. Perhaps they're already in housing and you're doing a checkup on the skills that they need and have. You might want to break it down into several visits. And, the wonderful thing about that is this is absolutely supportive housing related. It's absolutely tenancy related. It's absolutely going to get you, face-to-face time, and just give you another tool to use intentionally with the individuals that you're working with in housing. And so it's broken up into like 4 or 5 different categories, general support, independent living being the first couple. And so you can really like kind of break down your conversations with the individuals you're working with around those categories. So, moving in, getting settled in, staying safe from escaping domestic violence, things like that are really, important to find out about. And so what you do is, the person has the skill, needs the skill, and there's a comment section. And you can use that for yourself, and the individual can make any comments on maybe, specifically the things that they need help around. Yeah, Emily, it is. It is a really good way to get to know the person that you're working with, right? So, I'm going to say, well, let's see, I'm looking for one on here. Yeah, like the independent living skills, right? So, um, I worked with an individual who was married, ended up, his wife predeceased him, and then we started working with him, and he had no idea how to pay a bill, how to do any of that. It wasn't necessarily because mental illness didn't allow him to develop the skills. He came from a cultural background where mom took care of all that. Mom took care of everything in the household. Mom paid the bills. Mom did the cleaning. Mom wouldn't let anybody touch the dishes, right? Everything. And so it was a very like kind of matriarchal, like kind of like female dominated. So when he grew up, like that's just what happened. And he actually thought that his female case manager was going to kind of like subsume that role, and we had to have a little bit of a conversation that we're trying to build your independence, right? And so we were also dealing with I don't say dealing with, but like coming into collision with what he was accustomed to, right? And it made him really anxious to start to have to take on a lot of these new responsibilities. Yeah, Emily, right? So, cooking, absolutely. There could be a million ways to prepare a dish, right? Based on whether somebody likes it a little spicy or a little bit more garlic, no onions in it, lots of onions. And so that's another thing to keep in mind, that what our perception is, all of the garlic and onion, at least a whole head of garlic, roasted though. At least, you know, what our perspective about the individual's skill set is nowhere near as important as, and I don't say that to diminish our assessment skills, but we really need to ask these questions and listen to the person, even if we think that we know, right? Because nothing about us without us, and individuals have the right to communicate that, and if asked in a conversational way, can make grounds for a good conversation and getting to know somebody. Okay. Okay. So one of the reasons why we focus on skills training, and so this is kind of getting back to those questions that were there. Do you know how to do laundry? Do you know how to balance a budget? Do you know how to make a request, right? Or how comfortable are you? I like also asking that, how comfortable are you in doing this skill or executing this skill? People may be able to do certain things, they may lack some confidence, right? Or some sense of mastery over it. So we also want to help bolster those skills and ability to do things that they may feel a little bit, weak on. Yeah, great, Sabrina. So like, what does it look like when you do X, Y, or Z? A little different than tell me the steps, right? Maybe being that kind of like concrete isn't as conversational, but like, what does it look like when you do the laundry? What does that look like? You throw a whole bottle in like my little brother used to do, and then we have things, suds overwhelming the basement. What does that look like? Right? Another question that I do encourage, and I didn't learn to ask this question until I actually attended Emily's primary training responsibility is with our CSS folks. That's FCS in your world. So she trains all the CSS workers in the state of New Jersey because she's a superwoman. The folks she worked with, one of them trained me back in the day when they first started the training program. And one of the things that I remember one of the trainers saying is, ask somebody, what does doing well look like to you? Right? However you want to, like, if you're talking about a person's psychiatric or substance, recovery, or whether that is doing well at a job or just in general, what does doing that well look like to you? Right? And also asking a person about, I am a person who has challenges with depression and anxiety. And when that is particularly challenging for me, I don't really care what my apartment looks like. I don't care. Kind of looks like a 13-year-old boy's bedroom. Kind of does. Sorry to say, I'm 48, but it kind of does. Right? So, like, are there any, I like to ask this question, I don't think it's on the housing checklist, but how does your living environment reflect how you feel? what does it look like in your home when you're feeling good? Right? For me, it means my sink is clear. I'm actually cooking. I'm doing these kinds of things. I'm washing laundry. I'm doing all that because I feel good and I take pride. Right? So asking questions like that, like what does it look like when you're doing well? What might it look like if I visit you in your apartment and you're not doing so well, but you haven't told me? Right? So seeing if people will kind of tell you a little bit more about some of their indicators as you're starting to form that relationship can be really helpful also, and tying it into housing. And then asking people, well, when you're feeling that way and you don't feel like doing the dishes or you don't feel like washing your laundry, what are the supports that you would need to encourage you to do that, to help you do that? Right? Because we can all speculate on how things will go when we're feeling well, but we also have to build in those contingencies for when we're not feeling so well, and whether that's mental health wise or otherwise. Um, so unfortunately, so sometimes there is impairment in the executive functioning and critical thinking skills in some mental health conditions. Some of the ones who have a more long-term prognosis in terms of a lifetime prevalence, things like schizophrenia, especially your schizoaffective disorder. There's scientific evidence that there could be a disruption in the executive functioning. So what that can affect is things like planning, budgeting, right? Forming routines, cleaning routines, things like that. Even, schedules for work and being able to keep that organized, bill paying. And so, this is one reason why we really want to check in with around the activities of daily living and the things that keep the household running. Skill deficits may also interfere with successful community integration. So if an individual doesn't know how to do these things, there's a greater likelihood that they may return to being unhoused or incarcerated or in a psychiatric facility. And skills deficits can also create barriers to the achievement of rehabilitation goals, right? So think about the individual who's really struggling to maintain their living environment. And yet they feel socially isolated and they want to have people visit them. They want to increase their social network, right? So maybe they don't feel comfortable because they don't do the best at cleaning up or tidying up around the apartment, or they struggle with doing the dishes. Like I like to harp on the dishes because I don't like to do the dishes. That can prevent other things like social recovery, right? The ability for them to build and maintain significant relationships with others. Or executive functioning disruptions could, get in the way of an individual being able to secure employment or return to school. And also, as many of you know, one of the things that I always, that we say is we're always kind of working to put ourselves out of business, right? So our dream would be that mental health conditions are cured and nobody needs us anymore, right? And the consequences of mental illness are gone. I don't think that that is going to happen completely. But one of the things that we do want to strive to do is to build the skills in the individuals that we have so that they do not need us as much anymore, and so that we can offer additional support to individuals who may be experiencing a relapse of symptoms, or individuals who are new to our programs and may need like a higher level of support at entry. It also helps us to be able to kind of wax and wane services for individuals. Like I said, if we're building greater independence in the individuals that we're serving, we can step back the services that we're providing to them a little bit, build their self-agency, build their sense of self-reliance and self-worth, and also then create more time to be available when other crises arise. And I know you were all going to laugh at me because I know crises do not pick a convenient time when you have more time in your schedule to arise. So laugh at me now. But that is the purpose for, one of the other purposes for reducing the amount of reliance on staff that we want there to be. So let's talk about some skills deficits or why individuals may experience skills deficits. So we already talked about the lack of acquisition of the skills in childhood, adolescence, or early adulthood because of the age of onset of a lot of mental health conditions, right? So it could disrupt that normal learning pattern, that normal experiential learning that we all participate in adulthood. Lack of practice in quote unquote normalized settings. So again, I had mentioned earlier, thinking about individuals leaving hospitals or thinking about individuals leaving transitional settings, corrections settings, shelter type settings. It's an institutional environment, right? So a lot is done for the individual. This will not be their normal experience in the community. And so that is what I mean by normalized experience in a normalized environment, meaning where a person lives, works, loves, not in an institution where very often folks won't get the opportunity to do a load of laundry for themselves, right? Especially in certain settings. So we can't actually assess the skill. Positive, negative impacts, the positive and negative symptoms of schizophrenia. So individuals who experience schizophrenia, there are these two main sets of symptoms called positive and negative symptoms. And for about the first 5 years that I was in this field, I did not understand that at all, but it meant there was good and bad symptoms of schizophrenia. And then what I learned was these are the things, the positive symptoms are attributes that is added to the person that wouldn't be there without the illness, right? So things like hallucinations, delusions, those kinds of distortions, disturbances, and maybe critical thinking. And then the negative symptoms, things that are taken away or robbed of the person by the mental health condition. So think about isolating, lack of kind of like spontaneous verbalization. Folks maybe become hypoverbal, which is not talking as much, right? And so those negative symptoms are those things that the illness takes away from the individual and that we hope to restore with treatment, right? Therapy, skill building, medication for those who choose to utilize medications and, that full complement of treatment. And so those positive and negative symptoms of schizophrenia and other psychotic disorders could actually, cause the individual to refrain from engaging in those skill or those experiences, right? So like cooking dinner with family, maybe that wasn't something that the person could tolerate enough to be able to learn the skill set. Or the negative social symptoms of schizophrenia where individuals isolate, combined with maybe positive symptoms of, things like fearfulness or paranoia, can make it really difficult for people to develop their social network. And so these are things that we may be working with the individual on once they have a little bit of recovery from that mental health condition to be able to build those skills and, so the person can actually tolerate those situations without too much stress and anxiety. Learn dependency. So this again goes hand in hand with the, being hospitalized or being part of a system. So many of the people that we work with also, when you think about it, there's so many people that have been a part of the children's system of care, right? Whether it be that they were in foster care or in, children's mental health system of care. We had a lot of individuals that I worked with in supportive housing who were absolutely in the children's system. And kind of learned this dependency of being kind of shuffled around, having things done for them, never really being given an option. Especially not an option in their housing. You were going to where there was an available contracted bed, right? And in so many ways, our national, mental health system of care, which is very disjointed, but seems to function very similarly no matter where we are. People are, very much don't have a lot of choice and become very dependent on staff and the system. And so we really want to try to break that by building the self-reliance and agency. Individuals may have also neurobiological factors, again, similar to the positive negative symptoms of schizophrenia, there may be issues in the development and acquisition of skills following a normal, kind of developmental pattern. Also, a lot of individuals that we work with may also be dually diagnosed with intellectual developmental disabilities. And so we may also need to assess for supports in that area. Affective states. So what we mean by that is when I was talking about, and one of our participants also mentioned, what does it look like when you do that skill or when you practice that skill or do that thing? We want to ask about, what does it look like when you're not feeling well? Your mental health maybe isn't feeling that hot. You're not feeling well. What does it look like? What do you do? Right? And how does that affect taking care of the household? Environmental factors. So again, where an individual is residing, is it different than where they learned the skill? Is there a permanent residence or the supportive housing residence? Does it look different? Is it in a different kind of neighborhood? Are they going to have to learn public transportation and they've never stepped foot on a bus before in their life, right? These kinds of things can be really scary and intimidating. Poor self-esteem. So that idea usually, can go hand in hand with the learned dependency, the lack of practice, and obviously psychiatric factors as well, and perhaps trauma. But so helping to build these skills will help to increase the self-esteem and that sense of mastery. And motivational factors. Let's face it, we're all not motivated at the same level to do different things in our lives that we need to do, right? So if any of you have attended any of our trainings on motivational interviewing, a couple of my coworkers, Joni Dolce and Ken Kinter, do really great trainings on motivational interviewing. And we all are probably at a different stage of readiness to do something or to change something about our lives, whether it's, I want to relax more, I want to take more me time, or whether it's, I really want to get better at washing my dishes every day and not having a sink full of dishes. We may be at different levels of readiness to do that for a variety of reasons. Could have to do with our affective state, right? We might be feeling a little down and depressed, a little anxious, or we might feel, happier and ready for this. It may be that there's really no reason for us to make this change right now. Maybe the desire is low. And so understanding where people are in their readiness to learn a new skill, to change, to stop doing something, to start doing something beneficial is really important, because if we do not match people at their level of readiness to change or to learn something or to, do something differently, we're going to get frustrated. They're going to get frustrated. We're going to run into a brick wall. Our mental health system of care is essentially established in such a way that we meet people at action stage. We meet people at, you're coming to this treatment program. We expect you to work on your recovery, right? We expect you to work on these skills. The thing about human beings is we're not all ready at the same time. And so understanding the interventions, excuse me, that match an individual's stage of readiness is extremely important. And you can absolutely acquire more information about that from our trainings. We're going to be doing probably 2 rounds, two-day motivational interviewing trainings for probably supportive housing this next calendar year. So hopefully you'll attend. And so now let's just kind of skip to this process. And I say, if you've never heard of this, it sounds like a really basic concept. When you think about it, it makes a lot of common sense, but this is like actually established in science. But it sounds so simplistic, right? So tell, show, do. This is an intervention that we use in psychiatric rehabilitation services. So in all areas, we can use this in supportive housing, supported education, supported employment. And this is this process of, teaching the person the skill. So establishing a rationale for learning the skill is the first step in the tell. So why is this necessary? We could say things like, well, Dawn, you need to wash your dishes because you might get bugs if you don't, and your kitchen might stink, and you'll run out of pots and pans to make your Italian food that Emily was talking about. But what if I don't really care? What if my motivation for that right now isn't really about I don't care if my apartment smells. I have air fresheners, right? I have bug spray. You're getting a really bad image of my apartment right now, and I'm exaggerating a little bit. But can you make it meaningful to the person, or is it just washing dishes? Because just washing dishes isn't fun. So what is it? What are those higher, like, overall rehabilitation goals that the person has? If it's something like going back to work, you might think, like, how is this related? We might be able to tie it to that going back to work goal around, well, when you're working, you might have to pack your lunch. We want to make sure you get organized. It's good to start with organization in the home before we move on to the workplace, right? So establishing and being able to use that to establish a routine. Well, you want to go to work. Let's see if you can follow this routine in your apartment, right? Of every other day, making sure the sink is empty, right? So making it meaningful to the person, not just about like taking your meds as scheduled or washing your laundry. Discussing the steps of the tool. So we actually talk to the person, this is what's going to be done first. We can use pictures. And there are a lot of aids that are online, especially if you search for like occupational therapy tools, because occupational therapists do a lot of this work with individuals as well. Pictures of the steps that would be involved in, boiling pasta, or steps in financial budgeting. There's a lot of free materials out there that you can find to work with people. I think that there's a website called Therapist Aid or therapyaid.com. That's not an advertisement for them, but I believe most of the stuff there is free. And they have a lot of really cool worksheets in a lot of categories that you could find, in addition to what we're going to provide you with. Then we model the skill, right? So we demonstrate for them how to do it. Then it's time for them to show us. And so for an individual, you may have taught them the skill of, let's say, paying their rent, how to pay your rent, right? Maybe you taught them how to do it online. So you're going to maybe do it with them that first time. And the next time, have them show you how to do it, or to demonstrate it without clicking, and then have them do the clicking, right? So you want them to reflect that back to them so that you have an opportunity to correct them, not just show them how to do it and leave and hope that they do it. Not that you would do that, but leave and hope that they do it and it falls apart somewhere. So I have a kind of a coping skills example for that. We were working with an individual who was, again, we were working for Rutgers, but state hospital. One of my coworker and I to talk to an individual who was, kept coming back to the hospital. He wouldn't stay 2, 3, 4 days out of the hospital without having an altercation with his parents. He lived with his parents. He was about a 25-year-old male, lived with his parents. When things weren't going well for him, they'd start shouting at each other. Inevitably, the police would come. He was unable to have a whole lot of insight at that time into what he could do to manage his emotions a little bit better so that the police didn't have to be called, right? All he kept saying was it was a police problem. It wasn't a him problem. It was a police problem, and it was his parents' problem because they wouldn't get off his back. So we came at him with, okay, what we need to do is help teach him a coping skill. But he didn't want to hear that he had anger issues, because to him, it was mom and dad and the cops that had a problem with him, right? He didn't have any responsibility in this. So what we said was, all right, well, we got to really figure out a way to keep your mom and your dad and the cops off your back, because they're like being a pain in the butt to you, right? So we get it. They annoy you. Of course you get angry. Of course you get angry. But every time you get angry and you have an outburst, or you hit the wall, or they feel intimidated by you because you're raising your voice, they call the police. What can we do to avoid that situation so you don't come back here to the hospital? And the decision was made. He said, you know what? I'll go for a walk. I'll just go for a walk. I'll smoke a cigarette. I'll go for a walk. We were like, okay, we're not encouraging tobacco use, but good job. That's better than the police being called, right? Well, he left the hospital a couple months later and he came back within a week, which was better than 3 or 4 days. The issue was one of those days when he had the problem, it was raining. He didn't have an umbrella, was mad at his parents, so he didn't want to talk to them and ask them for an umbrella. So he didn't go outside. So he ended up still having police involvement and they came back. So we decided, okay, maybe we need additional coping skills, additional alternatives that you could employ when the environment is not conducive to using that coping skill, right? So that's a situation in which we taught a skill and we didn't think about how it could be influenced by something like the weather outside, right? Of course, he also bought a raincoat and an umbrella, but and learned a couple additional coping skills. Don't ask the question if he came back to the hospital because I don't know. We're going to assume he didn't because that fits my story here. But so we asked the person to demonstrate it, right? So in this case, the individual he tried to do it, but it failed because we weren't far enough ahead in planning for all contingencies, right? And so we bore a lot of responsibility in that. And so it's, to get that feedback from them, what went wrong, maybe what worked. There was one time during that week that he was able to take the walk. So he did see that it worked, right? And that one time he couldn't get outside and actually use that coping skill, it didn't work. And so it was problematic. We didn't like that he came back to the hospital, but it was also a growth and a learning experience for him. And then again, and again, providing that additional feedback and encouragement on an ongoing basis, and using those housing skills, perhaps not the skills as much, but the housing preferences checklist that you will see in the curriculum. That's really, really good to review every once in a while with individuals, maybe every year. Have your preferences changed, and not that we're encouraging people to like find different housing, but maybe there's additional supports that they might need so that their living situation continues to meet their needs. Additionally, with the housing skills, or with the tenancy skills, I should say, because it's not simply related to living in a residence, but also things like vocational services and things like that. Assessing that as people's needs change when they start to talk about, I might want to make some new friends, or I met someone and I'm starting to date someone, but I've had issues with my boundaries before, or if we know some history about the person, right, we might want to revisit and look at those skill sets. If they're talking about going to work and they haven't talked about that before, maybe we haven't addressed that skill or we put it down on the priority list of skills. So reviewing that at different milestones, different points in time. So if I know in a lot of most organizations, most programs have regulations in terms of how frequent, or policies and procedures, how frequently they need to update service plans or recovery plans or treatment plans, whatever it's called in your neck of the woods, or how often they need to update assessments for individuals. So you can maybe think about like using even those time points as guides to take a look at skills. And that could be used as a feeder for your service planning, right? And definitely all housing related and relative to FCS. Yeah, thank you for answering that question, Emily. Yeah, be on the lookout. The announcements haven't even come out yet. And that will be free. Probably be we're thinking probably in June, early summer, and then we'll probably repeat it again in like December-ish. We try to do them every 6 months. And so I'm gonna go ahead and start to wrap up by saying, this stuff sounds, when we talk about this and we say, yeah, of course, this sounds really simplistic. Of course, we need to make sure that people have the skills that they need to flourish in whatever environment that they find themselves in, right? And it sounds like a lot of the skills that we teach are simplistic, and they're really not, right? So for many of us, it's taken, much of our lifetime to acquire these skills, and that is with some experiential learning. And so I really encourage you to ask questions, even there may be some that are not on that list, that are relative to the environment where you live in Washington, right? So certain support needs may be more relevant out there and less relevant here. We just had a conversation a couple days ago about if somebody had asked the question if we provided or had expertise in any tribal services. And I use that term because it's a SAMHSA term, and that's the term that they used. So services for indigenous peoples. And here in New Jersey, we don't, because our population is so low with indigenous Americans. And so there may be different needs based on even your population characteristics, right? So that's why I say when you get the curriculum, you will see that it is very New Jersey specific in terms of some of the first module or two, but I would really focus on the utility of the worksheets. Okay. And of course, we don't want you to be an island unto yourselves and try to be everything to everybody. And I know as supportive housing, as FCS workers, it very often feels like that. We used to have an image of a landlord on one of our trainings that was related to landlord, I think communication issues with landlords. And this landlord was wearing this, tool belt with everything on it, right? He had a cell phone, he had a drill, he's for some reason had a band-aid, he had all of these things, he had a laptop because he runs his business, he's a man or lady of many skill sets. And really, for you guys, the same is true. You do so much for so many people, but we really want you to reduce the amount of burden that you place on yourselves and take your cape off sometimes. And take a break and take a breather. And that's why we want you to also, really look at the level of community support that the individual has, and to not, what is the word? Not downplay how much social, both formal and informal supports can aid you in your work with individuals. So addition to the community support, because so many people say that once they exit more communal type of living situations like institutions, shelters, mass shelters, and correction settings, feel disconnected very often from their community. And so we also provide worksheets on how to develop community supports, and those supports that whether they have them or not, they believe could help them in sustaining their community tenure. And we know that all of you are great resources for those different kinds of social support. So it is also broken down into those categories of necessary skills from the skills worksheet. And so if you find that an individual has, challenges in a certain area, or is, let's say it's challenges, or who may be doing well in a certain area like independent living skills, find out who those supports are. So that if the person is struggling, if you're seeing a change, you can reach out and also have that communication if, obviously they allow for that. Okay, and that is it for now. I want to open this up to anybody who might, oh, I'm sorry, wait a minute, 1 second. We didn't go through our full slide deck. I want to open it up to anybody who has any questions or comments at this point. Oh, no, thank you. So I'm going to go ahead and read through what we need to read through for the housekeeping at the end here. I'm going to start out by saying that the PowerPoint will be given to you in handout form. You'll also receive the tools for moving on curriculum that is used in the New Jersey State Psychiatric Hospitals. You are free to use that, free to reproduce it if you wish to reproduce it. just know again that there's a lot of New Jersey language in it. If your organization wants something tailored for your organization, feel free to reach out. We can talk to the powers that be, right? We can talk. And this will be emailed to you. Thank you, Dwayne. I just saw that question. These materials will be emailed to you by DBHR, Washington Healthcare Authority, usually within the next 24 hours or so. So the recording of the webinar, the handouts, and the handouts of the webinar, of the PowerPoint, and our resources will be given to you. So thank you. We appreciate all your time, attention, and participation. This webinar was hosted by DBHR through the Healthcare Authority. I'm not going to remind you again that it's being sent out. I just did. Don't forget to check out Washington's Foundational Community Supports newsletter for all things FCS and upcoming training events, including those motivational interviewing trainings. Also, I'm going to drop a website in the chat here for any individuals interested in free online trainings. We have some short online training materials in our state hospital project website. And Emily, I don't know if you want to drop FCS in there. I don't know if there's resources there too, but we have
For CSS? Or
CSS. I'm so sorry. Where do you work?
That's okay, CSS.
Sorry, guys.
I will put our CSS website in here with the disclaimer that we also do have webinars on various topics related to supportive housing. However, I will say that they are geared toward community support services or foundational community support services provided in New Jersey, and kind of sometimes based off of our regulations and how we provide services, which are very different than I think the way you provide services. So
Yeah,
all that to say, there's definitely a lot of information that I think could potentially be helpful to all of you, but just knowing that when you are viewing it, you might hear some language, or we might be talking about something very specific to our Medicaid regulations that is just not specific to yours.
absolutely. But free is free. And so feel free to peruse. Okay. See nothing else in the chat. So thank you everybody for being attentive and participatory. We really appreciate it. And we hope to see you back next month, second Wednesday. Thank you all so much. Bye-bye.